every time I saw a physician or a nurse get on the news, I was like, I could be there, I could help.
For them to need help, ask for help, be appreciative of help, I think is really telling on how stressful it is here.
I felt like if I had this type of, critical care training as a nurse, then it was kind of like a duty that I should do.
I had a nurse say to me the other day that she felt rejuvenated waking up, that she felt able to get out of bed and come to work because they knew that they had trained help.
I'm sure that there's plenty of people that never dreamed that they'd be working in certain areas and they've been asked to do that, and they are.
I've never been more proud to be a nurse because, people keep saying that nurses are resilient, but we have no choice. And the nurses here in Toronto and in Ontario especially, they have just had to adapt. They have no choice. Every day they're acquiring more responsibility, more things that they need to do just to keep the hospitals running, and they never say no.
Now we're seeing young people get sick and not getting better. And it's not a happy story. And every day you feel like you might not be giving someone the devastating news of their loved one passing, but you're still telling them, well, there's no change, which is still devastating because they're calling and they want you to say, they're a bit better today, but you're still telling them they're not.
And I think that that's the most challenging thing. I miss being able to hug my patients' families. I miss being able to my patient's family member's hand. Anytime you work in an ICU and you have a patient who is sedated and you're not able to connect with them, I always tell patients' family members, I know your loved one through you, so tell me stories. And I think that interaction is missing, and it's really hard. And these people are really sick, and it's really hard to talk to their loved ones at home who are also sick.
It's honestly heartbreaking. The patients, their families, the healthcare professionals, I just feel for us, we came up and it's like, okay, 3 weeks. There's an end in sight. We get to go home, and Newfoundland's living a fairly normal life. So we get to go home, isolate for 2 weeks, and then kind of go about our life. But they don't have that. There's just no end in sight for them. And you feel that, you can feel that. They're just so burnt out and they need a break. And I don't know when that's coming, but they really, really need it.
So I think it's going to be really hard for me to go home and not think about them every day, and not think about on my days off and on my summer leave how they haven't gotten leave in 16 months and how they haven't seen their families.
I think that as human beings, we're capable of so much more than we think that we are. I don't think that a year and a half ago we all would have said that we could do this kind of medicine, that we could endure it. And we have, and we can, and we've provided good care doing it.
Just like before, you just saw it on the news and you thought, oh my God, that's so terrible. But then when you come up and you actually become a part of that, you feel a little guilty going home. And I think I'm going to think about them every day.